Hello guys, I'm Shanmugapriya, lecturer in SNS College of Allied Health Science. Today we are going to see a topic under respiratory monitoring. In the last session, we have already seen about pulse oximetry and then capnography. Under capnography, we have also seen different waveform representing different conditions. In this session, we will be continuing with blood gas analysis. Measure the amount of arterial gases, oxygen and carbon dioxide, and pH. Normal pH is 7.35 to 7.45. Partial pressure of oxygen is 80 to 100 mmHg, and that of carbon dioxide is 35 to 45 mmHg. Bicarbonate is 22 to 26. How to interrupt arterial blood gas? pH less than 7.35 is acidemia, and more than that 7.45 is alkalemia. Look for carbon dioxide and bicarbonate. Respiratory acidosis, where the pH is less and PaCO2 and bicarb is higher. In respiratory alkalosis, pH is greater than 7.45 and partial pressure of carbon dioxide and bicarbonate is less than the normal values. In metabolic acidosis, the pH is less than 7.35. Partial pressure of oxygen, carbon dioxide is lesser than the normal value, and bicarbonate is also lesser than the normal value. Metabolic alkalosis, where the pH is greater than 7.45 and partial pressure of carbon dioxide and bicarbonate is greater than the normal values. This tabular column represents the blood gas analysis. Next, here comes the oxygen analyzer. It is fitted in the inspiratory limb of breathing circuit. It monitors actual value of oxygen delivered. It is used in closed circuit. Next, we have airway pressure monitoring. Airway pressure should be less than 30 cm of H2O. When this pressure is lower, it indicates disconnection. When it shows higher pressure, it indicates obstruction. Then we have apnea. Apnea monitoring. Cessation of respiration is called as apnea, which extends greater than 10 seconds. In intubated patients, apnea can be monitored by using capnography, airway pressure monitoring, and pulse oximeter. In non-intubated patients, airflow at nostril, chest movement, and pulse oximeter are the best methods to identify apnea monitoring. Next, we have neuromuscular monitoring. In this, we have going to see about uses. Detecting the onset of paralysis during induction, adequacy of block, plan for extubation. These are the main uses of neuromuscular monitoring. Types of neuromuscular monitoring, we have mainly three types. Train of 4, tetanic stimulation, double burst stimulation. In this, the train of 4 is the most commonly used method of neuromuscular monitoring. So, train of 4, the most commonly used modality for neuromuscular monitoring in clinical practice. The monitor delivers 4 stimuli, each of 2 hazards for 2 seconds, and the recordings are taken. Normal amplitude height of 4th and 1st twitches will be the same. That is, T4 by T1 is equal to 1. Twitches fade as non-depolarizing muscle relaxant blocks increases. Disappearance, the 4th twitch disappears, shows or depicts 75% of the block. And the 3rd twitch shows 75 to 80% of the block. And the 2nd twitch shows 80 to 90% of the block. This image depicts the train of 4 twitches with its amplitude height. In the next class, we will be continuing with central nervous system monitoring. Thank you.